These people had access to the best doctors, the best hospitals, the best resources money could buy, and yet they still managed to die from preventable causes. Not accidents, not sudden illnesses, just a series of decisions, negligence, and oversights so obvious that you'll wonder how they happened to people who had everything. These deaths, so avoidable it hurts to watch. Joan Rivers. New York, 2014, the legendary comedian goes in for a routine throat procedure, endoscopy. Simple, quick, supposed to be over in minutes. The doctors perform the endoscopy, fine, but then they decide to add an extra procedure, a laryngoscopy. They never asked permission, they just did it anyway. Here's where it gets worse. They stop monitoring her oxygen. The woman is literally losing consciousness, and they're not watching her vital signs, not monitoring her breathing, not checking if she can actually breathe. She stops breathing, her oxygen level plummets, and the doctors, taking selfies with their famous patient instead of paying attention. By the time they realize something is wrong, it's too late. Joan Rivers is gone. A routine procedure turned into a fatal one because someone decided to do extra surgery without permission and then forgot to check if she could actually survive it. The clinic later altered the medical records to hide what happened, but the family had evidence. Joan Rivers died from a preventable medical error so obvious that everyone involved should have known better. Neil Armstrong. Ohio, 2012, the first man to walk on the moon, literal legend. He's 82 years old and needs heart surgery. Fine. He goes to Mercy Health Fairfield Hospital for what should be routine cardiac care. The surgery goes fine, successful, everyone's happy. But then the post-operative care happens, and that's where the negligence begins. After surgery, patients need careful monitoring, vital signs, infection checks, pain management. Any complication needs immediate attention. This is basic medical protocol. Everyone knows this. Armstrong doesn't get that. His post-operative care is negligent, sloppy. No one is properly monitoring him. No one catches complications early. No one follows basic protocols. 3 months later, he dies from post-operative complications that should have been caught, treated, and prevented. The family sues. The hospital settles. $6 million. But here's the crazy part. They use a fake name, Ned Anderson, to hide it, to keep people from knowing that even Neil Armstrong, one of the most celebrated humans alive, can be killed by medical negligence. Even legends aren't safe from incompetence. Dick Schaap, New York, 2001. Dick Schaap was a legendary sports broadcaster, beloved figure. He goes to Lenox Hill Hospital for a routine hip replacement surgery. Hip replacement, one of the most common surgeries in the world. Millions of people get these every year and walk out fine. But Schaap doesn't walk out fine. While he's in the hospital, recovering from a successful surgery, he contracts an infection. Not from the surgery itself, from the hospital. Hospitals are supposed to prevent infections. That's like their entire job. Clean equipment, sterile protocols, basic hygiene. Not complicated. Somehow, Schaap gets an infection anyway, and not just any infection, the kind that gets worse because nobody's treating it appropriately. The hospital staff miss it, don't catch it, don't treat it aggressively enough. 3 months later, he dies from an infection he got inside the hospital, a hospital designed to prevent infections. His wife sues, wins, jury finds the doctors negligent, awards $1.9 million because a preventable hospital infection killed a legend. The irony, the hospital that was supposed to heal him became the place that killed him. Michael Jackson, Los Angeles, 2009. King of the pop, literal king. He's got a personal physician named Dr. Conrad Murray, and Murray's job is simple: take care of Michael. But Murray has a problem. He doesn't know how to take care of someone appropriately. Michael wants to sleep, so Murray gives him propofol. You know what propofol is. It's an anesthetic. You use it in surgery. You use it before operations. You don't use it to help someone sleep at home. That's like using a chainsaw as a toothbrush. Sure, it technically does something, but it's the absolutely wrong tool for the job. And it gets worse. Murray gives Michael the propofol and then leaves. Just walks away. Leaves a 50-year-old man unconscious from a surgical anesthetic with no monitoring, no machines, no oxygen. Michael stops breathing. His lungs shut down. His body shuts down. And there's no one there to help because the one person who should be watching is not watching. He dies from lack of oxygen because a doctor gave him the wrong drug and then abandoned him. Murray gets convicted, gets sentenced, but Michael Jackson is still dead because someone who was supposed to take care of him decided that the rules didn't apply to him. Los Angeles, 2016. Leonard Cohen, legendary poet and musician. He's 82 years old, which means he's at high risk for falls. Everyone knows this. 82-year-old people fall. It's common, it's predictable, it's preventable if you pay attention. But nobody's paying attention to Leonard Cohen. He lives alone, or with minimal supervision. He's 82, he's weak, he's vulnerable, and nobody set up his home to be safe for an 82-year-old. No railings, no emergency alert systems, no monitoring. One night he gets up, falls in the middle of the night in his own home, and nobody finds him. Not immediately, not quickly. Hours pass, maybe longer. He's lying on the floor, injured, alone. By the time someone discovers him, the damage is done. Internal injuries, trauma, no immediate medical intervention. He dies from complications of a fall that never should have happened because a simple thing, supervising an elderly man, never happened. This isn't medical negligence, it's negligence of basic human care. An 82-year-old man should not be alone and unsupervised in a home without safety measures, period. But he was, and he died because nobody bothered to prevent a fall that was completely predictable.
Minnesota, 2016. Prince, music legend, talent beyond measure. But Prince has been suffering from chronic pain for years, and to manage that pain, he's been prescribed opioids, lots of them. Here's the thing, opioids are dangerous. Mixing opioids with alcohol, with other drugs, with the wrong medications, that kills people. It's not a secret. Every doctor knows this. Every family member should know this. But nobody in Prince's life seems to be paying attention to his prescription drug use. Nobody's monitoring him. Nobody's checking which medications he's taking. Nobody's watching for addiction. He's got pain, he's taking pills, and then he's dead. Overdose, likely fentanyl, an opioid. His body shut down because his opioid use was never monitored, never managed appropriately, and never addressed until it was too late. Here's the brutal truth. His family didn't know, his friends didn't know, his staff didn't know, which means nobody was paying attention to one of the most dangerous medical situations you can have. Prince had everything except the one thing that could have saved him, someone actually monitoring his health and his medications. He died from an overdose that was completely preventable if one person, just one, had been paying attention. Hollywood, 2007. Anna Nicole Smith, celebrity, model, public figure. She's got pain, maybe depression, maybe anxiety, so she gets prescribed drugs. Lots of them. Multiple doctors, multiple prescriptions, multiple medications. Here's the problem. Nobody's watching the interactions between these drugs. When you mix certain medications together, bad things happen. Very bad things. Deadly things. Every pharmacist knows this. Every doctor should know this. But Anna Nicole's case, her doctors don't seem to care, or they don't notice, or they don't bother to check. She's on multiple medications from multiple doctors, and nobody is coordinating her care. Nobody's saying, hey, these drugs don't go together. She's found unconscious in her hotel room, with multiple drugs in her system, with a cocktail of prescription medications that should never have been mixed together. She dies from a medication interaction that was completely preventable if one person had done their job and reviewed all her medications at once. One pharmacist checking drug interactions saves her life. One conversation between her doctors saves her life. But neither of those things happened. 7 people, 7 preventable deaths, all because someone wasn't paying attention. The lesson? Money and fame don't protect you. Neither do the best doctors or hospitals. What saves lives is one person actually doing their job. These deaths were avoidable, all of them. One action, one person, one moment of attention. Subscribe for more. Stay safe, pay attention. See you next.